Right now at 4, Governor Dan McKee and the Rhode Island Department of Health are set to announce a comprehensive set of actions tomorrow.
Here's a look at the plan. Keep schools open for in-person learning, minimize disruptions to businesses while addressing an increase in COVID-19 cases, and alleviate pressure on the state's hospital system.
In recent days, local doctors have been talking about that very issue. 12 News reporter Alexandra Leslie joining us live in studio this afternoon after members of the Rhode Island Medical Society spoke to reporters this morning. Alex.
Well, Brian and Kim, the state's Medical Society President Dr. Elizabeth Lang noted while Rhode Island is a leading state in the nation with regards to vaccination rates, the Delta and now Omicron variants have now changed the rules of this pandemic.
The Delta and Omicron variants have made this pandemic a 3-dose vaccine event.
Dr. Elizabeth Lang says only about 30% of eligible Rhode Islanders have received their booster shot, which she says in part is fueling the current surge of cases.
Coupled with the fact that 24% of all Rhode Islanders are not vaccinated at all, a number that also includes children ages 0 to 5 for whom there is no approved vaccine.
Lang also noted children represent about 40% of Rhode Island's recent infections, double the national pediatric infection rate of 22%.
It's not necessarily that the children are sicker, but that the children are getting sick from the unvaccinated adults in their lives, and then they are passing it to the other vulnerable adults in their lives.
Dr. Catherine Cummings, an emergency medicine physician with Lifespan, says the surge is real and getting worse.
We don't want to believe that, but it is.
Cummings says by getting the word out again about prevention measures to take, like getting a vaccine, booster, wearing a mask, getting tested, and staying home if sick, she hopes people will heed the advice to stay out of the ER over the holidays.
Getting sick this time around or giving it to somebody else and bringing them into the emergency department over the holidays, when you didn't do everything you could have possibly done, that's something that will weigh on you the rest of your life.
And today also marks 1 year since the first COVID-19 vaccines were administered in the U.S. Coming up at 5, hear from the Department of Health on where things stand today, including recent delays in receiving COVID-19 results. Live in studio, Alexandra Leslie, 12 News.
First at 5, we're awaiting a COVID-related announcement from Rhode Island's governor and the Department of Health. Good evening, I'm Shannon Heggie.
I'm Mike Montecalvo. Tomorrow, we're set to learn about a comprehensive set of actions to address the recent surge of COVID-19 cases and to alleviate pressure on the state's hospital system. Officials say the plans aim to keep schools open for in-person learning and prevent economic disruptions to small businesses.
12 News reporter Alexandra Leslie spoke to the Rhode Island Department of Health ahead of the announcement about the state's level of infections right now, 1 year since the first COVID-19 vaccines were administered in the U.S. Alex?
Well, Shannon, in the last year, we've seen 3 vaccines be approved in the U.S. for people now 5 and older, which has translated to about 1.8 million doses administered in Rhode Island. But we've also seen new treatments like monoclonal antibodies and antiviral pills. Pfizer says new data confirms its antiviral pill reduces hospitalizations or death by 89% in high-risk, unvaccinated adults if taken appropriately. Dr. James McDonald says the treatment will be helpful if approved.
I wouldn't count on treatment to bail you out, because keep in mind, when the Pfizer product gets its emergency use authorization, I can guarantee you it will be in short supply. But I think it makes sense to say, well, look, I'd rather prevent a problem than treat a problem.
A big part of that prevention comes with vaccines, the very first of which were administered for the first time under emergency use authorization 1 year ago today.
When I think about where we were last year, oh my gosh, vaccine was in short supply. I think one of the things we really saw is that, people were nervous, and how was this thing going to work?
A majority of Rhode Islanders have since put more trust in the vaccines, with data showing 97% of adults getting partially vaccinated and more than 3/4 of the entire population getting 2 doses. The latest challenge is getting those who are eligible to get booster shots.
I think that's one of the most important things you can do before you celebrate any holiday. Get your booster underway and get that organized. All of us have to engage in our personal wellness. So we have to do what we can do. We do what we know works. And that begins and ends with vaccination, by the way.
Now, while there was an equipment issue that resulted in a backlog of COVID-19 test results around Thanksgiving, Dr. McDonald says testing is in high demand, with about 20,000 tests being performed per day, and results are still taking about 3 to 4 days to come back on average. Live in studio, Alexandra Leslie, 12 News.